stay in touch. We should stay in touch. Oh, stay in touch.
Namaste, everyone. This is Jason from Jace Therapy in Chicago, www.jacetherapy.com. I get a lot of emails and a lot of telephone calls about a service that I offer, CranioSacral Therapy. So I wanted to take this podcast to explain a little bit about the therapy, what it can be used for, and how beneficial it is for a wide variety of conditions. CranioSacral Therapy directly deals with your central nervous system. Your brain and spinal cord live in a cerebral spinal fluid. This cerebral spinal fluid is constantly being absorbed and reabsorbed throughout the day. Much like the heart beats to pump the blood through the body, the cerebral spinal fluid is absorbed and reabsorbed and moves through the brain and spinal cord by a hydraulic pressure model of the human skull. If you've ever seen a model of a skull or even a picture of a skull, you will see that there are little lines throughout the bones there. Well, those are called sutures, and actually they're more like joints because they move. Modern medicine tells us that these bones become fused, and while that is somewhat true, it's a little misleading. These bones separate and come together in a flexion and an extension motion, if you will, throughout the day, and move about a half a millimeter to a millimeter apart. This hydraulic pressure is the pressure that moves the cerebral spinal fluid through the craniosacral system. This expansion of the bones of the skull, this narrowing and expansion, creates what's called the craniosacral rhythm. The craniosacral rhythm can be felt anywhere in the body because of the pressure, the energetic pressure that is released during a flexion or extension phase of the bones. A craniosacral therapist can detect restrictions in your fascial system by using or listening to the craniosacral rhythm. For example, if I were to place my hands on both of your ankles, I could feel the energetic pulse of the craniosacral rhythm. I could detect which side was off, which side was weak, or where that fascial restriction was coming from. A big misconception about craniosacral therapy is that it can only be used for things that are directly involved with the central nervous system. And while that is somewhat true, it's great for things within the central nervous system: headaches, migraines, spinal cord injuries, head injuries, whiplash. It can be used to treat pretty much anything within the body holistically, particularly injuries or traumas that have been with us for quite some time. But I'm going to leave this episode as is right now, basically just giving you an understanding of what the craniosacral system is and what we're doing with you to try and facilitate your healing. In the next episode, I want to get into tissue memory, because with tissue memory comes the next and most amazing part of craniosacral therapy, which is somato-emotional release. Thank you. And remember, if you're in the Chicagoland area, we would love to see you as a craniosacral patient or massage patient. It's www.jacetherapy.com, or you can schedule online. You can also give us a call to schedule at area code 773-510-8930. Thank you, and namaste.